4. Chapter 3: The Digital Ghetto: Housing, Credit, and Encoded Segregation. Imagine this. You're Elena, a nurse and single mother, touring your dream home in a vibrant Atlanta suburb. Your savings are solid, your credit score strong, and pre-approval seems certain. A week later, the bank denies your loan application, citing a vague risk score. The algorithm flagged your zip code, tied to a historically black neighborhood with a legacy of high-risk loans, an echo of redlining maps from the 1930s. Now picture Juan, a recent immigrant and small business owner, applying for a mortgage in the same city. His application is rejected due to insufficient data, despite steady income, because his community's credit profiles are underrepresented in the system. This is the digital ghetto, a coded barrier that traps opportunity, locking entire communities out of wealth building under the guise of objectivity. Explanation: automated lending systems promised fairness, data-driven decisions free of human prejudice. Yet, they lean on historical data riddled with inequities. A 2025 Consumer Financial Protection Bureau (CFPB) report found that AI-driven mortgage models denied Black and Latino applicants at 40% higher rates than white applicants with similar credit profiles. Redlining, once drawn in ink, now lives in algorithms, with zip codes serving as proxies for race and class. In 2024, Wells Fargo faced a $10 million CFPB fine for deploying AI that penalized applicants from low-income areas, inflating rates or burying quality listings. For Elena and Juan, the system doesn't see their potential. It sees a past of systemic exclusion encoded into every loan denial. These tools don't just assess risk, they amplify segregation. Zillow's 2025 home valuation algorithms, for instance, undervalued properties in minority neighborhoods by up to 15%, per a Brookings Institution study, limiting access to fair appraisals. Credit scoring models, like those used by Experian, often penalize thin-file applicants, disproportionately immigrants and young people of color, for lacking extensive credit histories. The digital ghetto doesn't just deny loans, it cements generational wealth gaps, wrapping discrimination in the sterile language of optimization. Behind the code. Model family, gradient-boosted decision trees. Bias source: historic redlining data and credit records reflect systemic inequities. For example, 2010 to 2020 mortgage data shows 60% of denials targeted minority zip codes per CFPB, skewing risk models. Countermeasures: adversarial re-weighting. Adjust model weights to minimize reliance on biased features like zip codes. Fairness metrics. Use demographic parity to monitor disparate impact across racial groups. Synthetic data augmentation. Generate balanced datasets with tools like SMOTE to represent underserved communities. Example: pseudocode. Python. Hash gradient boosted tree with adversarial re-weighting. From XGBoost import XGB classifier. From Fairlearn, metrics import demographic parity ratio. Model equals XGB classifier. Model.fit xtrain ytrain, reweight equals demographic parity ratio. Fair predictions equals model predict xtest. Key takeaways. Lending algorithms perpetuate historical segregation by relying on biased credit and redlining data. Tree ensembles excel at finding correlations, but lack fairness filters by default. Adversarial re-weighting, fairness metrics, and synthetic data can prevent algorithmic enclosure. 2025 CFPB regulations mandating bias audits signal a push for equitable lending practices. Reflection question: how might your zip code or financial history shape an algorithm's view of your loan eligibility? 5. Chapter 4: The Digital Anesthesia: Healthcare Algorithms and Diagnostic Blindness. Imagine this. You're Maria, an artist and mother in Los Angeles, sitting in a dermatologist's office. A smart dermatology app, touted as precise and unbiased, scans your irregular mole and labels it low risk. The model, trained on predominantly light-skinned photos, misses the subtle markers of your early melanoma. 3 months later, a second opinion reveals its aggression, requiring urgent treatment. Now picture Wei, an elderly Asian American man with diabetes, whose AI-driven triage tool flags his symptoms as non-urgent due to underrepresentation of his demographic in clinical data. This is the digital anesthesia, a clinical fog where algorithms numb urgency, misdiagnosing marginalized patients under a veneer of objectivity. Explanation: predictive healthcare systems promised early detection and equitable care. Instead, they often deepen disparities. A 2025 study in The Lancet found that AI dermatology models misdiagnose skin conditions in Black and brown patients at rates 20% higher than in white patients, due to skewed imaging datasets. Pulse oximeters, critical for COVID-19 and respiratory care, underread oxygen levels by up to 5% on darker skin, per a 2024 FDA report, leading to delayed interventions. In 2024, the FDA mandated skin tone testing for medical devices, reducing errors by 20%, yet gaps persist in AI-driven diagnostics. For Maria and Wei, these tools don't just err, they erase, cutting off preventative care and endangering lives. The issue isn't malice but negligence. Medical datasets, like those from the Fitzpatrick skin type scale, historically oversample light skin, leaving algorithms blind to diverse presentations. A 2025 AMA report highlighted that Black patients were deemed healthier by risk models, reducing their access to kidney transplants by 15%. The digital anesthesia doesn't just misread symptoms, it codifies systemic undertreatment, turning data gaps into life or death oversights. Behind the code: model family, logistic regression, and random forests. Bias source: underrepresentation in medical datasets, especially imaging and calibration data. For example, 80% of dermatology images in 2010 to 2020 datasets were of light skin per NIH studies, skewing model accuracy. Countermeasures: SMOTE, synthetic minority oversampling technique, generate synthetic examples of underrepresented groups to balance datasets. Group-wise calibration, adjust model outputs to equalize accuracy across demographics using tools like Fairlearn. Inclusive data collection, partner with diverse hospitals to expand training sets, as seen in 2025 NIH initiatives. Example: pseudocode. Python. Hash random forest with SMOTE and calibration. From sklearn, ensemble import random forest classifier. From imblearn over_sampling import SMOTE. From Fairlearn, post-processing import threshold optimizer. SMOTE equals SMOTE. Xbalance ybalance equals SMOTE fitrysample xtrain y_train. Model equals random forest classifier dot fit xbalanced ybalanced. Fair model equals threshold optimizer model constraints equals equalized odds dot fit xtrain ytrain. Predictions equals fair model predict xtest. Key takeaways: medical AI tools reflect training data gaps, risking patient safety for underrepresented groups. Simple models amplify systemic undertreatment of minorities, misdiagnosing at higher rates. SMOTE, group-wise calibration and diverse data collection can restore diagnostic equity. 2024 FDA mandates and 2025 NIH efforts signal progress toward inclusive medical AI. Reflection question: how might an AI misinterpret your health data based on your skin tone, age, or cultural background?